Hello everyone, I am Dr. Sudha Udaya, Academic Director, Skills Development Academy and Pulse Academy of International Health Professionals. This message is specially for Sri Lankan nurses who have completed a 3-year nursing diploma and are now thinking about building a professional nursing career in Australia. Many nurses ask me one important question. Can I become a registered nurse in Australia with my Sri Lankan nursing diploma? The answer is yes, there may be a pathway, but it must be planned carefully. The first step is not simply enrolling in a course. The first and most important step is understanding how AHPRA and the Nursing and Midwifery Board of Australia, known as NMBA, will assess your qualification. The enclosed pathway document clearly identifies the AHPRA NMBA Self-check as the correct first step before selecting any study option. Australia has a very structured nursing registration system. For registered nurse registration, Australia generally expects a qualification comparable to an Australian bachelor degree, AQF Level 7. This is why Sri Lankan 3-year nursing diploma holders must be very careful before spending money on any course. Some students think that completing a Diploma of Nursing in Australia will automatically make them a registered nurse. That is not correct. According to the reviewed pathway document, the IHNA HLT54121 Diploma of Nursing is useful, but it leads to the enrolled nurse pathway, not direct registered nurse registration. The document states that this course is 18 months, 78 weeks, includes 400 hours of professional experience placement, and the international tuition fee is 36,000 Australian dollars. So, before making a financial decision, every nurse must understand the difference between enrolled nurse pathway and registered nurse pathway. They are not the same. The first step is to collect and organise your documents. You need your nursing diploma, transcripts, clinical hours, registration details, employment records, and English preparation plan. The second step is English preparation. Australia requires strong English communication skills for nursing. The document refers to English preparation through IELTS, PTE, or OET, and also lists an IHNA English language preparatory course of 3 months, with a cost noted as 150 Australian dollars. The third step is the most important. You must complete the AHPRA NMBA Self-check. This self-check will help identify whether you are likely to be placed into a registration stream, such as Stream B or Stream C. Your pathway depends on this outcome. If you are placed into Stream B, the practical pathway may involve preparation for the NCLEX-RN and OSCE. The document recommends the IHM Graduate Certificate in Advanced Nursing, Australian nursing practice, as a structured preparation pathway for Stream B candidates. It states that this course supports Australian nursing practice preparation, NCLEX preparation, and OSCE preparation. The duration is listed as 26 weeks, with a cost of 12,000 Australian dollars plus 250 Australian dollars administration fee. However, this is very important. This course does not automatically give RN registration. You still need to meet NMBA English requirements, pass the required examinations, and satisfy all registration conditions. The document also lists separate preparation options, IHMNC, LEX for RNs, 12 weeks, 600 Australian dollars, IHMOSCE for RNs, 2 weeks, 2,000 Australian dollars. This means Stream B candidates may have a more direct preparation pathway, but success depends on assessment, English, examination performance, and AHPRA NMBA requirements. If you are placed into Stream C, the pathway is different. The document explains that Stream C candidates usually need to upgrade through a qualification that leads to registration. For registered nurse registration, This normally means a Bachelor of Nursing pathway, rather than relying on a Diploma of Nursing alone. This is where students must be extremely careful. The document notes that the IHM Bachelor of Nursing was listed as 3 years, with a cost of $18,000 per semester, but it also states that the Bachelor of Nursing page was undergoing a NMAC and NMBA accreditation. Therefore, it should not be promoted as a confirmed RN registration course until formal approval is verified through the official approved programs list. So my advice is clear. Before enrolling in any Bachelor of Nursing, always verify whether the course is officially approved for registered nurse registration in Australia. Please do not make your decision based only on advertisements, agent promises, or social media posts. A wrong course selection can cost you time, money, and visa opportunities. A Diploma of Nursing may be suitable for some students who want an enrolled nurse pathway. But if your goal is to become a registered nurse, you must confirm whether the qualification leads to RN registration. Your pathway must be built around 4 things: your current qualification, your AHPRA NMBA, self-check result, your English ability, your final registration goal. My role is to help Sri Lankan nurses understand the pathway clearly before making major decisions. I will guide you to review your background, understand your likely pathway, compare course options, and identify the safest academic direction. But the final registration decision always rests with AHPRA and NMBA, and students must also obtain proper migration advice where required. So, if you are a Sri Lankan 3-year nursing diploma holder and your dream is to become a nurse in Australia, do not start by asking, which course should I join? Start by asking, what is my correct registration pathway? Once we know that, we can decide whether your best pathway is NCLEX, an OSCE preparation, an Australian nursing upgrade, an enrolled nurse pathway, or a Bachelor of Nursing pathway. I invite you to speak with me personally so that we can review your situation and help you make an informed decision before you invest your money and time. Thank you. I am Dr. Sudha Udaya, and I look forward to helping Sri Lankan nurses plan their Australian nursing future with clarity, confidence, and professionalism.